Which hormone is primarily responsible for maintaining pregnancy in the first trimester? Correct answer is option B, progesterone. Chadwick sign is an indication of. Correct answer is option C, vaginal discoloration. In a normal pregnancy, cardiac output increases by approximately. Correct answer is option B, 30 to 50%. Quickening is usually felt around. Correct answer is option C, 16 to 20 weeks. The hormone responsible for uterine contraction during labor is. Correct answer is option C, oxytocin. B.Sc sex sign refers to. Correct answer is option A, asymmetrical uterine enlargement. Which vitamin deficiency is associated with neural tube defects in pregnancy? Correct answer is option C, folic acid. The most accurate method of dating a pregnancy in the first trimester is. Correct answer is option D, crown rump length. Heger sign is softening of the. Correct answer is option C, uterine AIIMS. Which of the following is not a presumptive sign of pregnancy? Correct answer is option C, ballottement. Which immunization is contraindicated during pregnancy? Correct answer is option C, rubella. A pregnant woman with a BMI is greater than 30 is at risk for. Correct answer is option A, eclampsia. Which condition is characterized by seizures during pregnancy? Correct answer is option B, eclampsia. HELP syndrome includes all except. Correct answer is option D, hyperkalemia. The earliest sign of pregnancy detectable by ultrasound is. Correct answer is option C, gestational sac. Which iron preparation causes least gastrointestinal upset? Correct answer is option B, ferrous gluconate. Which pelvic type is most favorable for vaginal delivery? Correct answer is option B, gynecoid. Which of the following is a high-risk pregnancy factor? Correct answer is option D, gestational diabetes. Which is the most common site of ectopic pregnancy? Correct answer is option C, ampulla of fallopian tube. Which sign indicates fetal well-being in the third trimester? Correct answer is option D, all of the above. True labor pain is typically felt in the. Correct answer is option B, lower back and radiates to abdomen. The mechanism of labor involving internal rotation occurs at. Correct answer is option D, rotation. A prolonged latent phase lasts more than how many hours in praemie gravida? Correct answer is option C, 18 hours. The most common cause of postpartum hemorrhage is. Correct answer is option C, uterine atony. In vertex presentation, the presenting diameter during engagement is. Correct answer is option A, suboccipitobregmatic. Which drug is used to manage uterine atony and PPH? Correct answer is option D, both B and C. The third stage of labor involves. Correct answer is option C, placental expulsion. Shoulder dystocia is managed by. Correct answer is option B, Mac-Roberts maneuver. Lochia serosa typically lasts up to. Correct answer is option C, 5 to 10 days. Uterus returns to pelvic cavity by. Correct answer is option B, second week. Uterine involution is best assessed by. Correct answer is option B, fundal height. During labor, uterine contractions are best monitored by. Correct answer is option C, tocodynamometer, which is a sign of placental separation. Correct answer is option B, sudden gush of blood. Which of the following is contraindicated in eclampsia management? Correct answer is option D, oxytocin. Which surgery is most useful in uterine atony related PPH? Correct answer is option A, B-Lens surgery. Episiotomy is usually done at. Correct answer is option C, crowning. Which instrument is used for assisted vaginal delivery? Correct answer is option A, vacuum extractor. Which hormone promotes milk ejection? Correct answer is option B, oxytocin. Colostrum is rich in. Correct answer is option B, immunoglobulins. Which position is best during second stage of labor? Correct answer is option D, squatting. The most common cause of first trimester bleeding is. Correct answer is option D, threatened abortion. Which of the following is not a feature of preeclampsia? Correct answer is option C, seizures. Abruption placenta is best diagnosed by. Correct answer is option C, clinical features. A molar pregnancy is characterized by. Correct answer is option D, all of the above. Which is a major complication of placenta previa? Correct answer is option B, hemorrhage. Ectopic pregnancy rupture is a. Correct answer is option A, medical emergency. In RH compatibility, the most serious effect on the fetus is. Correct answer is option B. Gestational diabetes is screened by. Correct answer is option B. Polyhydramnios is most commonly associated with. Correct answer is option D. All of the above. Twin transfusion syndrome occurs in. Correct answer is option B. Monochorionic twins.